It was a time of high energy and also probably some fear.
We began to gear up for being totally crushed by COVID.
They knew it was scary, and you could see the fear in their eyes, but you also saw the determination to take care of patients because this is why they went into healthcare.
COVID affected everybody differently. These are patients that if COVID had never hit, they would still be alive.
We had changed our protocols. Within those first 2 weeks, we probably changed them 10 times.
I kind of thought in 2020 this doesn't happen. You don't run out of resources. You don't struggle with being able to care for the patients and your employees. That's not an issue.
Here we are at ground zero, managing, the infantry that's coming in every day.
You're trying to protect yourself, but you see your patient in front of you. It plays with the psyche in your head because it's like, I have to protect myself to save you, but I need to save you.
I know everybody says, the first year mark was like March, but we were getting emails like in December and January. And so we started prepping our department in the system back in mid-January.
And all of a sudden now it's real. It's a battlefield. It's not just a training exercise anymore.
And when we got the financials for March, I think we lost $40 million or something like that. April, we lost, close to $100 million. And so deciding what the right timing was to take costs out, we thought through it heavily, and we met with every leader, and every one of them delivered. We took $150 million costs out in the month of June and kept them out, and that required innovation.
Nobody in school went through this scenario, so they have to adapt.
A lot of the pieces that we had put in place early on really provided the infrastructure so that as the census grew, that piece didn't feel as overwhelming.
We were going to have to pivot very quickly and do some things that we had never done before in order to take care of the COVID patients and to keep our employees safe.
It was like something I don't think anybody's ever seen in American healthcare.
I'm a paramedic. I took a gentleman who, when he came in the front door, he was coughing horribly. I had on all my stuff, my gloves, my gown, my mask, but did I have on my eyeglasses? I said, oh my God, what if I just got it? And I did. 5 days later is when I went in the hospital.
It really started, another one of those middle of the night phone calls where we had an issue at a hospital with an employee, a potential exposure that we needed to figure out how far it went in our organization.
Just setting up the logistics of, who could come in with a family member. Everybody had to be masked. Everybody had to get COVID tested before certain procedures.
If they get tested Tuesday and their surgery is Thursday, how do we know they didn't get COVID in between, right? So you had to think about all those things.
We had to think about temperature checks, and we had to think about, have you been exposed? Have you been out of the country? Have you had shortness of breath? Do you have a cough?
There was a technology that came up, and you've probably seen these things around where you stare and it says welcome and all that. So much faster than anything we've ever done before.
We, at the same time, had to launch a new technology with our virtual visit platform, and we went from 0 to 80% of our clinic visits being done virtually in a matter of a month.
To have a human at the other end of the line, to hear what's going on and answer those questions, I think was something that Piedmont did differently, and I think we responded well in that regard.
It would have been very difficult to, especially during this pandemic, to maintain just as a single hospital.
We had spoken communication. We had video communication. We could not over-communicate.
We knew every day what each other was doing and what they were going through and how we could help.
And we were also in communication with other healthcare system, Emory, Wellstar, Northside.
And at many times, it was very important that we moved in concert. When you are seen as healthcare organizations moving in different directions, that could have a negative implication on the community's trust and their level of clarity on what to do. But when we would make statements together or make decisions together, it made sense to the community. This is how our healthcare organizations are responding, and it's the same.
And I remember the early stages of testing. The Department of Public Health got testing so we could do a test and send it to the state lab. It would take anywhere from 3 days to 30 days to get that result back, which clinically isn't helpful at all.
And then as it became more abundant, it was how do we get it direct to the patient? And we stood up drive-through testing.
We would set up collection sites where people could drive through in their cars and get their test sample taken, and then we would send it into a third-party lab or either our own labs. We had 4 of those operations stood up within 2 weeks. It's pretty amazing what we were able to accomplish.
The community's response, especially early on, was moving. Probably brought tears to my eyes a few times.
When we were having difficulties getting the N95 masks, University of Georgia stepped up big time. They were actually able to recycle them for us safely.
People who were seamstresses and things began to sew masks and just donate them to the hospital.
I remember Spanx converting a factory to make gloves for us.
There was a group here in Athens. They would bring meals, because it was such a struggle some days to get away, to get food.
I know one day it was just a lady who just made sandwiches for the unit and brought sandwiches in.
They would just drop off at the front of the ER, and if it was your turn, they would call you and you'd come down and pick it up.
My favorite community response and donor-supported initiative was the pop-up daycares. For our staff to be able to know that their children were safe and cared for while they were doing some of the most important work of our lifetime was really cool to see.
When COVID hit, people felt empowered to say, I can help, I have an idea, and I know where I can take that idea.
The nurses were asking these questions. Can we do this with our patient? What about this idea? What about this idea? Can we try this?
Literally, and one of the doctor's comments to me, we're throwing everything but the kitchen sink at people. We just don't know until we can find out what will work. And I'm like, bring it on.
We started having to become creative and figure out what works and kind of do that trial right there in the midst of it.
There were, shifts that you would end up moving, 4 to 6 patients around in order to get the rooms converted and get the patients in where they needed to be.
And if we ran out of ICU beds, we learned how to make an ICU bed and where to put the beds.
The first go-round, a lot of folks ended up on ventilators. Our second wave, we found out if we started them on high-flow oxygen, several of them didn't end up going to ventilators. That came with some unintended consequences of we're using a lot more oxygen than we thought, and that led us to putting in a new oxygen form which quadrupled our capacity so that we could provide the needed oxygen for our patients.
Probably the first day I was in ICU, 2 of the ICU nurses, how do you feel about the antibodies? I'm like, yeah, I'm all on board with that. If anything would help, yeah. That's when I got them. 24 hours, we were at that point. The pulmonologist was talking regularly with my husband during that point, and he called and said, if she shows no improvement in the next 60 minutes, I'm intubating. And I guess they went up a point or 2. I was at home for 6 weeks before I went back to work. When we had a first patient, he was super sick, and I went into the room to say, okay, we've already called the ambulance to transport you and all that, and I lost my being. I had to physically, literally leave the room because I knew what he was in for, and it just broke my heart.
I think we kind of wear a lot of hats as caregivers and we share them together because really when you're taking care of somebody, there's no one role that you play here.
I still remember patients we were ready to intubate and explaining him that the next step is to put you on ventilator, and he asked me, am I going to make it? It was a hard question for me to answer, and my response was, we will do our best. And he started crying. We did a FaceTime with his wife. I still remember that whole evening is in front of my eyes, and that's for same thing for each and every patient.
There were some patients when I was pulled to IMCU who just kept their family on video the whole time because they didn't want to feel like they were alone, at any point in time.
For a long time, it was the nurse that would stand there and hold the iPad over, and there was times where, you want to give them as much time as possible to talk to their family members and, but they would stand there until their arms were shaking.
We were in a safety huddle one morning, and labor and delivery nurses spoke up during the safety huddle. They had a COVID positive mom who had just delivered, and she was really having a hard time emotionally with the fact that she could not see her baby. And as a mom of 3, that really hit home for me. We started talking about monitors, and straight from work, we ran over and found the monitor that we wanted, and we brought it back to the labor and delivery unit. We gave one side to the NICU nurse, and she's got it in there on the baby, and we're all in tears at the nurse's station. And when the baby started to cry, the mother, she just fell apart. She could actually see her baby, and she could hear her baby, and she just fell apart, and I think we all did.
One of the things that came out of this is getting people to work together who either never worked together before or were sort of new to the organization. We had a unified set of priorities. Every other time in my organizational life, there's competing priorities. And that was the thing that we executed really well on. We've gained so much more trust for each other. Because you know what? When push came to shove, you had my back and I had your wing, and we worked together.
It required people to think very differently. And as I look back on it, we got it right. And it was one of the most remarkable organizational events. I mean, it's a rare experience to be part of that.
And then it was very quick to become aware that if we didn't focus on the staff, the patient could be taken care of.